So, Doc, what's
Yeah,
up?
I do. Offer.
I think cool. So, guys, two quizzes just happened in the chat, so enjoy.
Yeah.
So, I got to know more about your
Mm-hmm.
stuff to a mutual friend of ours, PY.
Yeah,
Shout
yeah.
out to PY Ado.
One time.
And then, yeah, I saw it on Snapchat and I
Mm-hmm.
thought I need to know about this. So,
Mm-hmm.
here we are. I've seen this beautiful painting
Yeah.
behind me, or beside me in this case. And I've learned a little bit about you. So, if I'm not mistaken, you are a doctor. You've been a doctor um,
Three
those
years.
3 years,
Yeah.
and then
Artist all my life.
access all your
All
life.
my life. Yeah.
Charlie, that's dope. I'll come for tutorials later.
Yeah.
So, when it comes to the medical side of you, that's what do you specialize in?
Specialist? No, no, no. I'm just an MO right now.
You're just an MO
Finished
right
my
now.
house job this year actually.
Okay,
So I haven't yet looked into specializing. No.
sure.
Yeah.
But what's your focus right now?
As in, what do I do?
Yeah,
General practice.
general practice.
OPD, regular clinic,
Mm-hmm.
emergency, yeah, basically that. And then, ward as well, but just general practice,
Just
if
general
you're not
practice.
well and you go to the
So I
hospital,
have a backache.
anything at
Yeah,
all, if it needs to be referred to a specialist, it will be referred to a specialist,
specialist.
yeah,
Nice one, nice one. So Charlie, with the arts,
yeah.
me personally, I shy when it comes to anything creative.
Oh, it's not even like that. You can do what you want to do, really. Anything you want to do, you can do it, yeah. I think everyone's an artist, if they're allowed to be. You just need to be bold enough to express yourself. Everybody has the way, the mind is, rolling out, and then
Mm-hmm.
what they actually express out there. And most of the time, it's two contrasting worlds. So I think being an artist is just, being true to yourself, bringing out, that version of you that's in your head
Yeah,
to the real world
say
without
world.
anything, hindering or preventing you from, expressing. I think that's art. So I think you're an artist. Like, you just have to be bold enough to express yourself.
I'll keep that in mind. And then who knows? Very soon they might see something expressive from me.
Yeah. Easy.
Right, so we were talking about strokes,
Yeah. Yeah.
and it's a disease that never goes away for
Mm,
certain people.
mm,
It's a disease that kind of has a huge impact on a lot of lives,
yeah.
directly and indirectly.
Yeah.
And you are making a difference. You're
Hmm.
trying to make a difference in your own way
Yeah.
and help people who have been impacted by um, stroke. So
Hmm.
one of it is through your art,
Yeah.
and you found a very clever way of using that to um,
Yeah.
like ease lives, ease burdens in people.
Mm.
So how exactly did that come into fruition?
Yeah. So, like I was saying earlier about expressing yourself as, genuinely as you can. So, I'm a doctor. Yeah. I work as a doctor, but I'm an artist as well. Okay. I think every time if people introduce me, they'll be like, "Oh, he's a doctor and he's an artist." Or I tell them that I'm actually an artist and
And then
a
doctor,
doctor because, like, I've been an artist, for the most part of my life, and then the doctor is just like a recent thing. Yeah. So those are two genuine parts of me, that for a long time were separated. One was going on and so on, the other two was doing its own thing. But I realized, I think we were talking earlier about how
you can
exactly, and I told you that I was at work. I realized that there was actually a stroke crisis. People come with strokes, and it's either they're coming super late because people couldn't figure out or realize the early signs, or they come early and maybe they don't have the money to afford a CT scan to actually diagnose, what type of stroke. it is. So I realized that that was something that was ongoing. Third world country, most of the people can't afford. I mean, how much do people earn if they have to cover 1,000 plus for ambulance plus CT scan and other stuff? It's not that easy for everybody. So you find a lot of stroke patients coming in, prognosis worsening because the time factor and the money factor, and also the education factor, because people cannot even recognize the early signs to bring them on time. Yeah. So that's something that I was passionate about. Like, how do we solve this? And then, luckily for me, I'd been exposed um, um, to Kolebu, where the pediatric department have something called a purpose fund, especially the pediatric surgery department. So when I was in my rotation there, I realized that they are able to pull in funds from doctors just working there, house officers, MOs, specialists, consultants. It just takes some money, not too much, some 20, 30, 50, and then there's a fund. So anytime there's a patient, a child who can't afford something, parents can't afford something, take out of the fund, just document, and then it was working, and it was very active. It was always working. So I was like, why can't we do something like that for the stroke side as well? So that's how the idea came about. Now, whilst this whole conflict, like I said earlier, was going on with, how to solve the stroke crisis, then there was also another thing that was going on, with me trying to be an artist, like, because, doctor is very time consuming, so you get to do anything else. So it's like, how do I actually be this version of me, which is really who I am, two genuine versions of me, but why does one have to suffer? So, um, two wars were going on then. I think I had a conversation with one of my friends one time, and then he was like, could we just join it together? And I was like, well, so it was actually, it took a long time to actually come up with this idea. It took at least 2 years of struggling internally to figure out that I can use art to in the medical field. I can use art in healthcare because largely medicine is art. I remember I was having a conversation with one of my consultants and he was telling me medicine is art, especially surgery. And I was like, yeah, I think I agree with that. So um, I make art, use it to create awareness for the early signs of stroke. Because then, like we mentioned earlier, there are three issues: the issue with education, issue with time, like time, bringing them on time, and then um, the issue with money. So with the art, I could educate, teach people the early signs of stroke, the importance of timely intervention, in stroke disease. Then also teach them. I mean, as you're using the art to teach them about early signs and all that, like they understand that they need to intervene quickly. Then also, if they pay to see the art or they buy the art, or just through the NGO and then there's money coming, it could pay for CT scans for some of these patients. So that's basically how the idea came together. But it's evolved, like with time, it's evolved. The idea has evolved over time. There's so many things, there's so many ideas, there's so many plans regarding the NGO and the art thing. So, like I can't wait till you guys see how we actually. And it's a good thing we are doing this. Just kind of see the journey,
Yeah.
because I feel like art is real. You see a painting when you start, it's like, Charlie, what's this? Then when it finishes, it's like, wow, that's beautiful. So I feel like you're going to see the beginning parts of the whole Te-Apo journey, and then when we get to the point where everything pieces up, everything works out, and then we've actually solved the stroke crisis through art, right? Yeah.
Charlie, brilliant. And then with regards to the early signs of detecting a stroke,
Yeah.
what are the early signs that people may see but may not recognize?
Yeah. I think they it's to be right in your face, like you'd see it. You just have to know, be educated on it. So some of them their speech will start becoming slurred. When you talk to them, you realize that they are dragging words, maybe they are slow to respond, all those things. So their speech essentially becomes slurred. Like, it's instead of saying hi, Kwasi, what's up? It's
Very
like,
cool, Charlie.
hi, Kwasi, what's up? And
Like
like
it's always
the
tired.
tongue is like just rolling off the words because and then the mouth wouldn't really open, and they are trying to speak just through a little slit. Then also there'll be drooping of the face to one side. That's one-sided weakness. You see that either the lip will be, like because the muscle is pulling, one side of the face is weak, the muscle on the other side, get to pull that side towards it because this side is weak. So you realize that the stronger part of the face would be pulled to that side exactly, and then this eye will be drooped and all those things. So um, those are some of the early signs. Then there's also the very obvious ones where they have total limb either weakness or paralysis of one side. You know, they wouldn't be able to lift their arm or even move their arm at all. Or sometimes it's just weakness. They are not as strong in that side as they would be in the other side. Yeah, and it affects up and down. One-sided, so it affects both the arm and the leg. So either the left side or the right side, depending on which side of the brain the stroke has occurred at. So if people know these signs and it happens like that, they know that okay, I don't need to put them in bed and then let them rest. I don't need to give them water or go to the pharmacy. Like I need
Give
to
them a
rush.
massage.
I need to rush them to the hospital. Okay. Because sometimes you see these signs, it's not actually a full blown stroke. Something called a TIA, transient ischemic attack. So it just is transient, and sometimes it leads up to a full blown stroke. So if someone comes in TIA, we do the CT scan, we see certain changes in there that suggest that there was an infarct or there was something blocking blood flow to a part of the heart, but it has been
Cleared.
it has been cleared. But then that means that the person is at risk of it. So the person may get a stroke, so they need to be treated as well. Then there are people who come in full blown stroke. But if they come early enough and there's a block gauge or whatever, we can give medication to relieve it, and then with time, physio and everything. There was one patient that Te-Apo helped. Actually, the first patient, she was in hospital for 48 hours. Just like I've worked my entire life, I never saw a stroke patient come in and out of the hospital in 48 hours. Immediately she came, she was what's it called? We did the CT scan immediately. Like the family didn't have bread, they didn't have money. It was obvious. Like I even called one of the people aside, asked them that like it's the issue, money, blah blah blah. I run this NGO, all this stuff like that. And once we did a CT scan, we found out what the issue was. We started treatment. Within 48 hours, she was good, and she's been going for reviews. She's okay. Like there's still some residual deficits. Like she's weak in one side, and that one physio. I've tried to convince the family that they should invest in physio. You realize that the problem is bigger than just the CT scan, because even after you have to invest in physiotherapy and all that, it's not just the drug. So at least she's alive. She has life. She can walk on her own. There's still some residual deficits, but she was out of the hospital in 48 hours, and not a lot of doctors have even seen that before, especially in like the rural setting when patients come in with strokes and stuff like that. Like they are there. If you go to Kolibu stroke unit, they are there. They are there. They are staying in a hospital. So timely intervention, and you said earlier actually, I don't know if you remember, you're like the disease that never goes away. I feel like that's a myth too. It's actually a myth about stroke. With early and timely intervention, it can actually go away. Yeah, you would be at risk of a stroke subsequently because you have that history, but it can be treated.
True.
Especially when it's the one where the artery is blocked. If it's detected early, it can be treated completely. The bleed is a lot more. So there are two types of strokes: the bleed and then the one where the artery is blocked. So the bleed is a lot more problematic, but when the artery is blocked, it can be treated. And majority of the time that is the issue. So I think I think I've spoken a lot. So
So what exactly tends to block the arteries?
The arteries. You can have blood clots. So if you're at risk of clotting and all that, that can happen for various reasons. Maybe you're super obese and you're always in your bed. Your mobility is compromised and stuff like that. So obesity for sure, number one, is up there. Um, and another thing is cholesterol plaques. So atherosclerosis, those plaques too can dislodge and then go and cause that block. Then, um, I mean, those are the common ones, either a blood clot or the atherosclerotic plaque. Yeah, these are two common ones. So we are looking at obesity being up there as one of the main causes. Then we have post-surgery. If someone just had a surgery and because of that they are clotting easily and stuff like that. Then we have high blood pressure. No, you're asking for what blocks the artery,
Your
right?
blood artery. But
Okay.
you've also given me the next question, which would have been what usually causes a stroke. So
The bleed, right?
yeah.
So the bleed, high blood pressure. Then if you have aneurysms in the brain, so an aneurysm is like a bulge in the artery wall, which will definitely be weaker than the rest of the wall, right? So when the blood pressure is flowing, at a high pressure, it can burst that bulge and then you bleed. Or just high blood pressure, uncontrolled blood pressures for a long time can, burst some arteries in the brain and then you bleed into it, and then that could also cause a stroke. So yeah, I feel like these are the two main, on a layman, level, the two main ways to get a stroke, and then the the main things to predispose someone to having a stroke. Yeah,
Jai, thanks for that.
yeah,
I mean, I feel like I've definitely been educated myself, so
okay,
I trust that others who would catch this conversation would also
yeah, yeah,
feel happier knowing this and then knowing how to one observe it, to
yeah,
try and prevent it,
yeah,
and then to manage it if and when it happens.
yeah,
So with Te-Apo,
yeah.
the art,
Mm-hmm.
how did it actually start? Like
The NGO.
the NGO.
So I told you that there was the problem,
Mm-hmm.
the stroke crisis issue. Then there was me trying to be an artist as well, which eventually
Merged.
merged and then with time evolved. But then it's like, okay, you're doing the art to educate and raise some funds, but it's more legitimate if you do it non-profit, because if I come up to you and say, oh, I have this art piece, buy it for this amount of money, it's going into a stroke fund. How do you believe what I'm saying? So that's where it came up. Like, okay, so let me create an NGO. Let me call it Te-Apo, which is I can't forget well, and then let's do this thing. I never had the full picture, and that's art. Like I told you, me, I never have the full. I won't come to you and tell you I've fully figured out how Te-Apo is going to move. Nah, but it's moving and it's going to keep moving. And that's the thing, one step after the other, and we're going to actually do everything that we set out to do. So the mission for Te-Apo is that we are making CT scans accessible, to everybody, regardless of your financial background. Everybody, actually. So that's the
Everybody.
plan. So to have an active fund that has enough money, and then we are connected with the various hospitals and imaging centers. And then when there's any call coming in from an emergency unit or a hospital about patients who can't afford, we intervene with the funds and then they get their scan done. So it's just for the CT scan, no drugs, no physio or anything. It's really just to be able to diagnose and quickly intervene. You know what type of stroke it is. So that's our mission. Okay, long term, we have another mission, but for now, one step at a time.
Sure.
Long term, we have a separate, a bigger mission, which we will tackle later on in time. But for now, it's establishing the Te-Apo Stroke Fund to be able to cater for needy stroke patients with regard to paying for their CT scans. Yeah.
This lovely pacing.
Yeah.
Let's talk more about it.
Okay.
what is it, first of
So,
all?
um, it's actually a painting I made last year. Okay, so it's called a running woman or running lady, and at that point, I hadn't come up with the whole Te-Apo stroke and all that. So it was just a painting of an abstract painting of a woman running, with her hands on her head, trying to signify like some type of
Danger
crisis,
or hey.
you know. And when I started the NGO and I was looking for an avatar or like an art piece for the NGO, funny enough, I used this, but it wasn't like I meant for it to signify timely intervention, but it just pieced up together. Like when I picked up the art piece, I remember my wife actually told me that when I selected that art piece, it was actually an art piece. So I just made it bigger on cardboard, but it's actually on a canvas, right? So it was just an art piece that I picked and decided I was going to use that um, for the what's that thing called, for the poster for an event that we were going to do. So it had the event details and then it had the picture of the running woman on it, just for artistic purposes, right?
Yeah.
And funny enough, it's just connected, because the running lady and we are trying to push for timely intervention and stroke time is brain, so we need to be quick about everything. So it pieced up. It wasn't really intentional. It wasn't like I wanted to, and that's really my art, my creative process. I'll even like to majority of the time, the things I do, that wasn't the plan when I set off to do it, but it's just all just pieces up nicely by the time I'm done. Yeah, so that's the purpose of this avatar. It's like with time I realized that look, this could actually even be the avatar for the whole movement, like
Yeah.
the running lady. So that's how it came about. I'm sure you're expecting some deep meaning
It's
behind
actually
it,
deeper.
but
It's actually deeper than you thought because
yeah.
I'm just trying to picture a scenario where somebody is showing a sign of um, being ill.
Yeah, that's true.
You go, you are trying to wake the person up or whatever is not
Mhm.
happening. Obviously, you run and call for
You
help, so
exactly,
it fits
yeah,
perfectly for me.
yeah. So that's the thing. It fit eventually, but it wasn't really the plan when I set off to do. When I was actually painting it, I was just painting. I was just really painting. I'd come up with the idea with crayon on paper, and I transferred it to canvas, and yeah, I guess it worked. So
A few days ago, I was interacting with some other creators, and they're talking about you getting your like peak creators in general,
mm.
getting their inspiration from things that are around them, and
Mm.
this fits.
Mhm.
But
Mhm.
in
Mhm.
in
I didn't even
enhancing
think
that
about it like
convo,
that.
I have to ask, as an artist,
Yeah. Mhm.
what inspires you, and which inspiration do you see historically that you kind of have similarities to?
Historically.
Is there Van Gogh? Is there Michelangelo? Is there, oh, yeah, just your
I
own?
think you have gotten the wrong artist. I don't know too much about like classic art, and I mean I love art. So if I see a beautiful art piece and I love the meaning behind it, so I'm able to read something nice out of it. Yeah, like I love art, but I didn't first of all I didn't study art. I did science, then I went to do medicine and everything. So I've not truly exploited that like with regard to education.
Yeah.
So I don't really have an inspiration in the art world, but I have a very strong, you know, source of inspiration with regard to just creating, and that's Kanye West. And Kanye West is not actually just a musician; like he's a whole creative. I'm sure he does album art, artworks. He does
He produces sound.
shoes, even clothes and stuff like that. So yeah, he's a creative,
Yeah.
and he's uh, my mentor. Yeah, somebody I look up to. Like if when it comes to living, like not even just creating, just living, you know, being yourself, um, being as expressive as possible, Kanye West. So he's not, we didn't have to go to the 1800s or 1600s, no, like just right now,
Yeah.
Kanye West. So yeah, he inspires a lot of my art actually. So the collection for Brew, which is the art event, the first auction that we're doing in October, like the first 5 pieces, I think, or the first 6 pieces were inspired by the first 5 or 6 um, albums Kanye did. Yeah, so I love his
So
music.
the graduation, the
Yeah. Oh, you know,
oh
look at that. You
yeah,
actually love Kanye too, right?
yeah,
So yeah, graduation late registration. Sorry, college dropout, late
college dropout,
registration. What's it called? Graduation,
dark twisted
reiterating.
fantasy.
Yeah, actually ends at Yeezus. That was the last one I used to inspire. Then the rest of the art pieces came from like other sources of inspiration. But yeah, so I took the color hues from those albums, and then just the colors, and then I cooked up some
Your own
pieces.
style.
Yeah. So yeah, I love Kanye, and I think he's a real one. Like he's authentic. He's legit, and he's someone that I look up to. And yeah, I'm not saying trying to be like him. I'm trying to be the best version of me, but like he's just somebody who's taught me how to approach life in certain ways and stuff like that. So yeah, definitely. That's where I would say a source of inspiration comes from. And I make music too, like I make beats. So Kanye, yeah.
Nice.
And the pieces for the exhibition are actually they are it's coupled with a sound. So it's not just the art, like it's the art with a beat together. That's the complete art.
Package.
Exactly. Yeah.
Nice one. Nice one.
Yeah.
Charlie, this is innovative. I mean, I don't think I have another word to describe it. This is innovative. So
Yeah.
big ups to you. And how do people get in touch with you?
So for now, it's it's just largely the NGO, you know. So you know, you can get in touch with me on Instagram, right? Or if it's related to the stroke, which I hope it is, you know, you can get in touch through the NGO. You know, like it's not that huge right now, so trust me, you're not going to be going through some plenty bureaucracy. You're going to come directly
To you.
to me or somebody very close to me. So yeah, if it has to do with health, stroke, yeah, which I hope it is, especially because like, we are not trying to get confused at this
Stick
point.
to the plan.
Yeah, we're trying
Yeah.
to stick to the plan. So, like I'm hoping any people reaching out, it's even if it's about the art, it's about raising funds for stroke or it's about creating awareness for stroke. You know, yeah. So yeah, definitely Instagram. Our NGO's number is on the page too. So you can get me on my Instagram or you can get the NGO on Instagram or Twitter, LinkedIn. I think LinkedIn, LinkedIn too will be really helpful, especially on a professional level. So LinkedIn. My name is Kwasi Ankrah. So on LinkedIn, you get Kwasi Ankrah. On social media, it's mostly Kwasi Boryo. Yeah, and then the account is Te-Apo. Yeah, I think you do something where maybe
It will just
it will
show
come
up.
there, and so then they'll be able to see, and then they can follow or they can reach out and all those things. Yeah.
And you know how people still love walking. So like if they wanted to meet you in person, where would they best be
Meet me.
advised to?
Oh, then definitely one of the exhibitions, like one of the preliminary exhibitions. I think the preliminary exhibitions would be easier. Like we'll be doing one tonight at Talkative Mom Studios. Shout to Green and Talkative Mom. She's been the most supportive, crazy support. Like not even just with regard to the NGO and the arts. Like me as Kwasi, like she's been so supportive and so much. Um, yeah, so we'll be doing one event at her studios this evening. We'll be doing another one next week. I'm sure this video will come later, but like so yeah, on the 22nd, right, of September. That's tonight. Yeah. So yeah, we'll be having an event today, and then we'll be having one the following week. I don't want to announce it here, but wait. Then again, it will come later, right? So we'll probably have announced it because we'll announce it tomorrow. So It will be at Jumbo Spaces.
Okay.
Yeah, then we'll have one at Sinel Hospital, stuff like that.
Charlie, Kwasi,
Yeah.
thanks for your time,
Thanks.
and I wish Te-Apo the very best.
Yeah.
Progress, make people's lives so much better than they are,
Yeah.
and let the arts keep expressing itself as well.
Yeah. So I mean,
We
the
go
most
vibe, we go
important thing
vibe.
is
Yeah.
the stroke thing, right? We need
Yeah.
to hammer on that, So if we can even get, if through this people can donate to the fund, yeah. I mean, you don't have to be at the exhibition, or if it resonates with you one way or the other, you want to donate to the fund. Hey, do that.
That's right.
Yeah.
Charlie, thanks again.
You're welcome.